you give me your thoughts on headaches? If somebody has chronic headaches, they go to their primary care doctor. The primary care doctor throws their hands up, tries a few things, says, you better see a neurologist. Are there some neurologists that enjoy taking care of headaches, or does everybody hate it?
No, there are. There is a subspecialty in neurology where people focus on just headaches. You can get a special fellowship in that and get board certification.
Really? There's a board certification in
Mhm.
headache neurology.
That's right.
Oh, that's great to
But
know.
it's also the case that neurologists in general, headache would be a common thing that they would see patients for. So you don't have to be exclusively specializing in it.
It's a bread and butter thing.
It's a very bread and butter thing.
Yeah.
You don't have to see a neurologist, but you certainly can. I would say that a large number of primary care physicians are perfectly good at diagnosing and managing headache problems. So let's talk about a couple of things with headache. Because the pain feels like it's within the skull, then it feels like this is a brain problem. Although quite often it's not. All right. Everyone worries that it's a brain problem. And the brain is certainly involved in many headaches, but it is unusual that there is something structurally wrong with the brain, like a brain tumor or a clot in a vein. These can happen. These can be causes of headaches. But actually, most of the time, that person is a perfectly normal, healthy brain, and something is functioning in a way that you'd rather it not function. When I run upstairs and I get short of breath, I don't have damaged, diseased lungs. I'm just fat.
Right,
I'm just
right.
unconditioned.
And older.
Right. So my lungs aren't functioning the way I would like to. There's nothing wrong with the lungs. Similarly, the brain sometimes doesn't function the way you want. Doesn't mean there's a disease of the brain in a structural sense. So when we think about headache problems, how should we approach this? The most common problem, the most common mistake from a doctor point of view, or to some extent patients as well, is that when there's a headache, we spend very little time thinking about cause. And we spend a lot of time thinking about treatment. Which makes sense.
Because you're in pain.
We don't want to be in pain.
Make it stop.
So you take something to make it go away. And by the way, that works on a lot of the time.
Right.
So it's not a terrible idea. When a neurologist sees a patient for headache, that's been tried. And that's failed. And so what we're really doing, and other doctors could too, is we're taking the time to sit down and think through what's the cause. And we get to the cause of the pain rather than the treatment that knocks it out.
Gotcha.
So when a lot of people get into trouble and they come to see the neurologist, the trouble is no longer the thing causing the headache. The trouble is the treatment. The treatments they're taking are now as much of a problem as the cause of it was. So the first thing we want to do when we're considering a headache problem is to think, well, what's the cause? We want to treat the cause if we can, or do things so it's harder for a headache to get started.
Right.
Because one of the common things is that most things that cause headache don't stop quickly. So it's very hard to turn a headache around and abort a headache. So a neurologist's focus is on preventing headaches. What can we do to prevent headaches? And we can crudely divide headaches into three categories. There's primary headaches, there's secondary headaches, there's a third category called face pains and neuralgias. So a primary headache there's nothing structurally wrong, but your nervous system is doing something we'd rather it not chose to do.
Okay.
Migraine is the famous example of a primary headache. What's a secondary headache? Well, a secondary headache is not a neurologic problem at all. A secondary headache is your nervous system doing what it's supposed to. Your nervous system's job is to take an information, sometimes tell you about it, and sometimes do things about it. If you don't like it, it's not the nervous system's fault. You got an axe sticking out of your head. It's supposed to hurt.
It's reporting a noxious stimulus,
right,
as it's supposed
that's right.
to.
There's nothing wrong. There's nothing wrong with my nervous system when I have the pain of a heart attack.
Right. It's working really well. Thank you.
And the third category, in part because it's managed differently, face pains and neuralgias, is a nerve may be mechanically irritated, like in trigeminal neuralgia or occipital neuralgia. These are some of those. So there is a group that has tried to divide up all the different types of headaches and give you rules for deciding which headache this person has. And it's a series of diagnostic questions that you ask, and you categorize the headache as headache type number 1 or 2 or 3. It's called the International Headache Society. It's an international body, and they have a current working document that gives the clinical criteria for diagnosing all the headache syndromes they recognize. By the way, let's play a game.
Please.
How many headache syndromes do you suppose they came up with?
24.
317.
Why am I not surprised?
So part
Okay.
of why managing headaches is tricky is that what everyone tends to assume is it's all migraine.
Right.
But in fact, there are a large number of headache syndromes. Now, many in that 317 are esoteric. They don't happen very much. About 10% of that 317 are migraine variants.
Ah.
But they all behave a little differently, and how you manage them, how you prevent them is a little different. So to a neurologist seeing a headache patient, they start by saying, my gosh, I wonder if this isn't migraine after all. Is it a different type of headache syndrome? Or if it is migraine, which of the 30 or so migraine variants is it? And what things have been tried, and to what extent are the treatments actually starting to cause the problem, and so on. So if you take in a very systematic way, treating and managing patients with headache is actually a fairly doable thing. When I was a resident, I did not like seeing patients for a headache complaint. But at that time, I was very new to being a neurologist, and the patients that end up in a resident clinic, all the attendings in the department have already taken the patients for their own specialties. So the patients that end up in a resident clinic often are patients that don't easily slot into another attending. And so you often saw less clean cases, much harder ones to figure out.
Tricky ones.
So I had the wrong idea that most headache patients were really hard to figure out. When I came to Columbia and I entered that private practice, which I was in for 6 years, I learned an awful lot about clinical neurology. And one of the things I learned early on is headache patients are actually, I found, very satisfying because we can almost always help.